Well, chances are you know someone who's been diagnosed with prostate cancer. It can be a deadly diagnosis if it's not caught in time.
News 6 investigator Eric Sandoval was diagnosed with the disease earlier this year. During his cancer journey, he found out doctors are seeing more and more younger men with prostate cancer, and they want more men to be screened.
So I just found out that I have prostate cancer. I'm a little shocked, but not really, because my dad had it. I don't know what to feel.
That was me back in January when I got the news from my doctor. I became one of the nearly 300,000 other men in the country diagnosed with prostate cancer this year alone, the second leading cause of cancer death among men.
Okay, a quick anatomy lesson. The prostate is part of a man's reproductive system. It's a gland that sits right below a man's bladder. Doctors measure its health by testing its PSA levels, or prostate-specific antigen. A normal range is anywhere between 0 and 2.5 nanograms per milliliter. Mine was 10.5, so something wasn't right.
So here's the prostate right here.
I first met Dr. Patel 10 years ago when I did a story on his cutting-edge robotic surgery.
Does it make you nervous at all not being in the same room as the patient?
I never thought I'd be on the other side.
I'm looking through a camera that has 10x magnification in 3D vision and depth perception.
He uses a machine called the Da Vinci robot. Patel has now performed more than 18,000 prostate surgeries. As a matter of fact, I was patient 18,001.
When you see that age that says, mid-40s, early 40s, what do you think?
We know it's a different discussion. They're always scared. The last thing they want to know is about prostate cancer. They have other issues going on, work, kids, young kids, and they're just like, why me? I think it's always a harder discussion because everything's on the line.
Dr. Patel and his colleagues authored this research paper where they tracked more than 11,000 patients who had prostate removal surgery. They found that they were treating younger patients with higher grade diseases, and the increasing number of high-risk patients has led to worse side effects after surgery.
Do you think there should be guidelines for younger men to get screened or get screened at a younger age?
So it makes no sense to me why you would not screen for the second leading cause of death in men of cancer when you screen for other things that are less more morbid in many ways.
Those guidelines are created by the U.S. Preventative Services Task Force. Now, right now, they recommend men ages 55 to 69 years old discuss the possibility of testing their PSA levels with their doctor, especially if they have a family history. No testing is recommended for men over 70 or under the age of 55. We contacted the U.S. Preventative Services Task Force and asked them if they plan to update their recommendations. They responded, saying, "We are currently reviewing the latest evidence to update our recommendation. And while we can't speak to what we will find since we're in the middle of this process, the task force is deeply committed to understanding everything that the research tells us and using that to provide guidance that can help men live the longest, healthiest lives possible."
I want to thank you for helping me.
You're welcome. That's our job, and we enjoy it.
Okay, so why don't all men just ask to get screened? Well, we found out it's not that simple. Insurance may cover it, and it may not. Some states mandate coverage, other states do not. Some insurance only covers the test if you have a family history like I did, or if you're over the age of 55.
All right, we're guys, we've been in locker rooms, we hear about the sort of what people think is an invasive test, but tell us, what is this test called and what does it involve?
It's a blood test. It is a simple blood test. You go and get your blood test, and again, if insurance doesn't cover it, I have to say this, my brother-in-law, because of what happened to me, he went to go get his blood test, and the doctor said no. And he asked why. He's part of an HMO, and they said, we do not cover it. So there are places online you can order your own test kit. That's not the optimal thing to do. You want to go to a medical professional.
But if you walk in, you go PSA.
PSA, prostate-specific antigen. You can probably get it. Just pay out of pocket. It's about $130. It's not a lot of money. but it's peace of mind.
Yeah,
Your story's
absolutely.
already making a difference. We aired it at 4:30 today,
Mm-hmm.
and one of my someone on Facebook, Terry, she says, "I lost my husband to prostate cancer, aggressive stage 4. He had it for 8 years." She said,
Wow.
"Thank you for the story on the news." So it just lets people,
Thank you.
even if it touches one person, Eric, you are really helping. So
Thank you.
I'm glad you're on the other side.
We're
of
so
it.
glad you're okay.
Yeah.
Me too.
Man.